Thanks for coming in today.
No problem.
Right. So now just to recap your history, because I know I've already obviously seen you once for your consultation. You have a bit of a problem with snoring there.
I do, yes, yes.
So how long has that been going on for?
I think it's been going on for since I was probably in my early 20s.
So for quite a long time.
Yes, it has, yeah.
And you'd said to me before that you tried a few other measures, like you managed to lose quite a bit of weight, which was great. Yeah, and you also used things like a chin strap.
Yes, tried that once. It didn't really work. Yeah.
Did it just not work, or was it just really uncomfortable?
It didn't really fit my shape of my head. Yeah.
It didn't really fit that well there. Yeah, and so at home, do you find that snoring causes a little bit of sort of tension in the household? And
Yes.
Things like that.
Yes.
Yeah. Sort of upsets partner and things like that. Yeah.
And the kids.
Yeah, and the kids. So it would be nice to improve matters for you.
Yeah.
And as we mentioned, with the laser, it's a treatment that uses laser energy to cause a controlled heating effect at the back of the throat, and that stimulates the contraction of collagen fibres and hopefully stiffens up your palate so that it's not flopping backwards and vibrating to cause the sound of snoring. And we also find that people tend to get a much more refreshing night's sleep with it. Quality of sleep can be improved. It can be very helpful if you've got like a mild degree of sleep apnea. And the nice things about the laser treatment are that it's a very safe treatment. There's no side effects with it. There's no complications that I've ever had. We don't need to give you any medications. You can get back to all of your normal activities straight away.
Yep.
And we do a course of 3 treatments. We do day 1, we do another one after about 2 weeks or so, and we do another one after about 6 weeks. And we find that tends to give very long-lasting benefit. So often the benefits will last a number of years before you might need to have a top-up treatment. But there is a small rate of non-responders. About 10 or 20% of people don't respond, and in my experience, that's people who are very overweight, people who have a lot of nasal problems, like they can't breathe through their nose properly, and people who have maybe just not a very good level of underlying health and fitness, so they're not so good at producing new collagen. So hopefully that won't be the case with you.
Okay.
So we'll crack on and get underway with our first treatment.
No worries.
Okay. Yeah, I'm just going to give you a few pulses there so you can get an idea of what it feels like, right? So what does that feel like?
Just a slight warm sensation in the back of the throat.
Sure. Yeah. So that basically is it. Okay.
Yep.
Shouldn't get too much, hotter than that.
Yep.
Okay. But let me know if you need me to stop, and I'll stop. And we do 10,000 shots. It will take me about 15 minutes or so, and we'll be stopping from time to time.
Okay.
So we can see there's nothing actually touching the throat at all. It's just a heating treatment. There's no cutting, no burning. We don't need to use any anaesthetic. If people are really sensitive around the back of the throat, we can use a local anaesthetic spray to numb the area, but in my experience, it's very, very rarely required. We keep the laser moving fairly quickly, so we're not dwelling on one spot for too long. The treatment is where we're just going to use the laser on the sides of the tongue. It slightly shrinks the tongue bit. Okay, so we get you to stick your tongue out. Just grip it with your thumb and finger like that, and then pull your tongue off to the left slightly. Okay? So, just pull your tongue off to the left and slightly up. Try to grip the end of your tip of your tongue. That's good. Okay. And so I'm going to go fairly quickly now because it gets fairly hot around the tongue, so you don't want it to dwell on one area for too long. This bit doesn't take very long at all. Now, which is where we get you to take a deep breath in and sing a long R note. And the effect of that is that it helps to lift the back of your throat up, so we can treat right down the back of your throat, and also the air going in and out tends to keep it a little bit cooler, so we can use a slightly higher power setting on the laser. Okay. So I'm just going to turn the power up a little bit. So you get your take it both in and go like that. And when you need to take another breath, you just take another breath. Okay, and you carry on going through that.